Sitting here with Dr. Sam Wagner. How you doing?
Good, man. How are you?
I'm really good. I'm pumped that you're here because you traveled all the way from Wisconsin.
Yep.
And, it's not the closest flight, so appreciate you making the trip to come out here and sit with us and tell us about your journey just as a chiropractor and kind of like what got you to where you are today and all the things that you've learned along the way. So I guess my first question is like, where do you come from? Like, who are you?
Yeah, man. Well, first off, thanks for having me. I'm excited to be here. Where I come from. So, like you said, came from Wisconsin. My parents moved us from Chicago when I was young, so we were literally right across the border in Wisconsin, and went to high school there, went to undergrad there, and then went to graduate school in Atlanta, Georgia, and that's what ended up going to chiropractic school and that kind of whole journey. So I guess how in depth do you want me to get?
Yeah, I mean, that's a great start. Like, so what even made you want to go to chiropractic? Like, was there, like, sometimes when I talk to our providers, especially the chiropractic ones, for whatever reason, sometimes it starts with like, I was banged up, I had an injury, I saw a chiropractor, and I was like, this is awesome. I want to get into that. I don't know if that's the same for you, but
yeah, I mean, there's some similarities. I was an athlete all growing up. And
I can tell.
Yeah, thanks, man. The real big kickoff for chiropractic, my brother actually had an injury. We were in like middle school basketball, and he came down, and my parents took him to the emergency room. He went to a neurosurgeon because he had this crazy back injury, and he was basically told at, I think we were 12, 13, you can't play sports anymore. That was kind of where this all started. And then one of my parents' family friends told him to go see a chiropractor. And then he ended up being able to play later in the season. And so that got the ball kind of rolling for me, and the wheels turning. I'm like, this is so cool. This guy's helping someone, and he's just using his hands.
Yeah.
I thought that was so powerful and so neat. And he got to set his own schedule, be his own boss. He coached his kids' sports. I was like, that's so cool. And you can stay involved in athletics. So that's where that kind of started and transpired for me. So my parents...
And that was middle school for you?
That was in middle school.
Wow. So seed got planted early.
Yeah, very early. And then that was always in the back of my head. I always knew I wanted to do then chiropractic or medical school. Was a pretty high level athlete in high school, dual sport athlete in college. Was fortunate enough to be able to pursue playing football professionally after school.
Get out of here.
Yeah, and so chiropractic was always a huge, huge part of that. It helped my performance, my recovery. But as I evolved as an athlete, I saw that chiropractic wasn't just, a quick adjustment here or there. There's so many other things that you could incorporate into care. And I remember when I was pursuing playing professionally, I was doing my combine prep at a gym in Chicago, and there's another chiropractor that came to see us, but he wasn't only adjusting us. He was doing some different soft tissue treatments and using some different modalities. And that really, really piqued my interest. I was like, well, if I'm going to go this route, this is ideally the type of demographic of people I want to work with. This is the type of thing I want to do. And I remember specifically, I shadowed him after I had pursued playing, had an injury myself, and just was like, all right, it's time to attack the next goal, next dream. And I was shadowing him in his office, and his last patient of the day was an emergency room doc. I'd already been accepted to medical school, already been accepted to chiropractic school. I was practicing EMT at the time. I was like, okay, maybe I want to do ER stuff. And she asked me, do I want to help people? And I remember like, well, that's such a dumb question. Yeah, of course. And she's like, well, if you really want to help people, go be a chiropractor. So the next day I submitted my acceptance to enroll in the next quarter of classes at Life in Atlanta.
Wow. And so that was a medical doctor that said that to you?
Yes.
Wow.
Yeah.
That's crazy. All right, I have to ask, just from being a sports fan myself, what were the two sports that you were playing in college?
So I ran track for one season. I played basketball for a season and then played football all 4 years.
All right, so you ran track, you played football. I'm thinking you were a corner?
I was a safety.
Safety. Oh, so close.
Yeah, I was safety. I returned kicks and punts, and then
Speedster.
I went to smaller schools, so I ended up playing some slot receiver and doing that as well. Playing on both sides of the ball.
Did you get injured in college, you said, or was that after?
I this whole side, broken hand.
Oh my gosh.
Dislocated the shoulder.
Wait, is that your ball carrying side? Like you're righty?
I am right-handed. Yeah.
So maybe that was
Yeah.
interesting.
But when I was pursuing playing professionally, I had a stress fracture in my shin.
Oh, okay.
And I was in a mini camp with the Winnipeg Blue Bombers, and I went to cut, and just kind of crumbled on. And I was ready. That was kind of my last hurrah, and I knew it was time to go chase the next dream.
So that's cool. So like you're in a mini camp, you have this thing, but you already like had set yourself up to be accepted into med school. Like,
yeah.
You were doing it all simultaneously?
Yes.
Wow,
Yeah.
that's
I was
impressive.
just because I knew that, I would love to have played football forever, but you can't.
Yeah.
So that's where I wanted to make sure. I always knew I wanted to go to, like I said, chiropractic school or medical school. So I wanted to make sure I still was doing my due diligence to make sure I had another avenue to pursue.
Wow. Well, we're going to have to find some time to throw a football because I got a laser rocket arm and you got the hands and the speed. So
yeah, let's do it.
All right. So you get into chiropractic.
Yep.
And that's amazing advice you got from that doctor to tell you if you want to help people get into chiropractic. I imagine you didn't open up your own clinic right away.
No, I was an associate for a couple of years.
Yeah.
Like, man, right out of the gates, I was like, okay, yeah, I can do this. I was about 90% there. The 10% was significant enough for me to just, hey, how about I learn? How about I, save, put some money away, really get an understanding of what this even looks like? Because I have never practiced before. I've never been a doc before. And that was really important to me. And I had a really, really great experience because it taught me so much of what I really wanted to do and what I didn't want to do. And so July of 23, I ended up opening Rehab Lab Wisconsin after I was an associate for a couple of years. And pretty shortly after that, I remember going to a continuing education training. I went to the same school that Dr. Madison went to. He went to Life as well.
Dr. Madison, our medical director here at StemWave.
Yep.
Amazing.
And he spoke, and he was talking about dry needling, but then towards the end of it,
he loves dry needling.
Yeah,
loves it.
It's amazing. I love that too.
I get it done on myself too.
Yeah, it's incredible. But then he also started talking about StemWave towards the end. So I was like, okay, I'm kind of interested in that because I had seen different types of shockwave therapies, things like that.
But at your clinic, you were just doing all manual stuff, right, at the time?
Yeah, it was more of like a functional medicine clinic, but I was still doing more like Graston and ART things. We didn't have really any modalities. And
had it even like popped on your radar to even like look into that kind of stuff at that time?
It had a little bit, but I knew, I was like, well, why don't I just do this for my clinic? Because I don't know if this fits in with the model here.
Right.
And so that really like sparked my interest. And then I had gotten, I was running, training for a half marathon, and I like had some weird issue with my foot, and I couldn't really figure it out. And one of my buddies had some sort of a shockwave device, so he used it on me. I was like, this is interesting. But Madison, the connection, he's been talking about StemWave. I need to look into this. So
do you remember what it was about what he was saying about StemWave that like stuck in your mind?
Just the results that people were getting. And he had been working with professional athletes, and that was what I was currently doing. I was like, okay, well, this is probably something I really, really need to look into. And so I got on a phone call and on a Zoom call pretty quickly with Sam and
on our sales team.
On the sales team, And I remember it was August, so it was a month after I'd opened. And at the time, StemWave still was very new, and they were working out kinks, and I was trying to work out some kinks because I didn't have like 2 years of running my own solo business. And we had to figure out a way to make it work and to make sure that I was able to get the device in. And I mean, man, it's been 2.5 years, and I have 2 clinics, 3 devices now, with the potential to grow and expand more, and StemWave has been a massive part of it.
Wow. 2 clinics, 3 devices. That's unreal.
Yeah, man.
You're like the StemWave mascot.
I'll wear that badge proudly.
No, we have a mascot outfit right now.
Okay. Well, yeah, we can do that next time.
We have one in the works, but you're not going to be wearing it. So, like, walk me through a little bit about like the whole process of you getting your StemWave.
Yeah.
Like, so you said you talked to some people on our sales team. I know you had heard Madison talk about it before, but like, what was it specifically? Because, you know, it was so outside of what you had been doing before that even though you had your friend do some, you know, I don't know if it was like true shockwave or radio pressure wave. So, okay. So you've had something done on like your injury before, but what was it through the process that like really made you go like, yeah, like I'm going to bring StemWave in? Was it the fact that like you got to try it out before like agreeing to it? Like, what was it?
Yeah. I mean, that was a massive part of it. And I think I guess what would you want to call it, like customer service or not?
Yeah.
Like I was speaking with the director of sales, like we were texting. He was really concerned with my experience and wanted to make sure that I had the resources and the communication and the available lines to connect if I had any issues, or even if I didn't have an issue, just to learn like, hey, how is this doing in your practice? Are you crushing it? Are things going well? Like that mattered to me a lot. The relationship aspect, because there's so many different types of modalities and things you can do, but I didn't have that experience talking to anybody else. And StemWave from day one, like they cared about me more as not just a clinician, but like, hey, how are you doing? What do you need to do? How can we make this as great of an experience for you? How can we make sure this is the most impactful for your patients and you're getting the results? Because at the end of the day, right, that's what's most important. Like I can get all this new tech, I can get all these different things, but if it doesn't work, if the patients don't get better, right, then what are we doing?
Yeah, and I think that's a great thing to mention. I talk about this all the time when I do my, you know, webinars twice a month with different providers. It's good to say this out loud. Why is StemWave here as a company? Like, obviously we have a great device and obviously we want to sell those devices, but beyond the money aspect, it's about changing people's lives, about getting people better. And the reason why StemWave is here is to change traditional healthcare, is to avoid the surgeries that are unnecessary and the injections and all the invasive things and the pain pills, and offer like a solution that is natural, non-invasive, and has amazing results. And so I think it's like really important to talk about that, of like what separates us from other companies. Like, we stick around. We want to make sure that you guys are provided with everything that you need to be successful, because at the end of the day, we're successful when you're successful. And that means the patients are successful.
100%. I mean, it's been such an important piece of the puzzle for me. And now even if there's anything that comes up, I can just fire off a text to someone and I get a response pretty instantaneously. And like, if there is an issue, don't worry about it. We'll overnight something to you. And that's very few and far between when you hear about some of the other devices and the upkeep and things like that. That was another big selling point, I guess, to me, was the maintenance of it is pretty hands off.
Yeah.
And it's pretty streamlined. It's like, it's not very difficult to do and to see the results you can get. Like, one of the biggest pieces and this will always be in my mind as far as patient care. Mm-hmm. I had this woman that came in. She was scheduled to do bilateral knee replacements. She's like, I've been in pain for 10 years. Nothing has worked. I saw an ad. You know, I've read your reviews. And I'm like, okay, I'll give this a shot. And so she came in. I did the StemWave treatment on her. And then she started crying. And, you know, I'm like, oh, no. What did I do? What happened? And then she just gave me a hug. And like, I'm getting a little emotional even talking about it, but she's like, that's the first time in 10 years I haven't been in pain. And like, that's why we all went to school. That's why we all went to do this. And adding this in that short of an amount of time of treatment in conjunction with all the amazing things we learned to do, it's a no-brainer.
And it's like what that doctor said, like, you really want to help people?
Yeah.
This is the way. And like, that's not just treating the pain and the injury. That's giving someone like hope back in their life.
100%.
To be able to like live the way they want to live.
Because they've been through the gamut of the traditional model of all these different clinicians and visits. And I worked with her for 15 minutes. And that was the response. That's incredible.
Yeah.
So that was another massive time in my short amount of solo practice. Like, okay, well, we need to get this to as many people as possible.
I was like, how many people who are in the medical field as professionals get their patients that hug them, that have like those tears of joy and hug? And like, that's what I think, like, really, I love shouting from the rooftops about StemWave is those types of reactions, because we're talking about people that are able to play with their grandkids, to be able to like ride bikes with their family, go upstairs, go on the vacation that they've been trying to plan for years, but didn't think they'd be able to walk around because their knees hurt so much. Even little stuff like feeding themselves, brushing their hair, like people that have these like frozen shoulders and things like, they haven't been able to lift their arms over their heads for like 30 years. And now they can reach something on a top shelf or brush their hair. Like, that's giving someone their life back. That's not just treating an injury.
100%, man. I just had a patient, a couple of weeks ago that had come in, and he's in his mid-30s, and he's like, I go to the traditional PT, and I get treated like I'm 70, because like, hey, show me how you would vacuum. Show me how you'd reach something in the cupboard. And they're not using any of these things. And we use StemWave. And he was like, yeah, that's the most I've been able to bend my back in 2.5 years. And he's had multiple surgeries. And it's just that type of relationship, like you talk about, like getting a hug from a patient. Like, they're not a number. They're a person. So you need to treat them that way. And using different technology like this has only built the trust in that relationship, and more importantly, the results.
Yeah.
It's been awesome.
And then it's really amazing for you because they're looking at you now as like this wizard who can give them their life back. For sure. Know? Especially the ones that have gone and gotten diagnosis like, oh, you need surgery. Oh, this is unfixable. Right. Like, sorry, you just got to live this way. And I've been lucky enough to sit down with patients that are StemWave patients and talk to them about their journeys as well. And I know a lot of them have a similar beginning to their StemWave journey, which was, I was told X, Y, and Z by some sort of medical professional, and I thought this was going to be the rest of my life. And I always think about that. Like, that is such a, like, just upsetting state of mind to think the pain I'm in is for the rest of my life now.
Yeah.
And like, there's no hope.
100%. And the words carry weight.
Yeah. For sure.
And that's not at all to talk down on any sort of other professional and the way that they practice, because a lot of it is the way that they're taught and the way that they communicate, but there's different resources. Like, it's not, hey, this is your only option. I would say that's not always the case. Like, you exhaust all options until you absolutely need to go down that route.
Yeah, and there's limitations too. I mean, like
100%.
Almost every single one of our providers that I talked to, they were limited in the scope of what they were able to provide their patients, and they would have to refer them out to someone else before they had StemWave.
Yep.
And it's really cool to hear now. It's like, that's not even an issue. It's like, no, everyone stays in-house. In fact, I get referrals from other people that they can't help them, and now all of a sudden, because I have StemWave, we can help them.
Yeah.
What's cool is, obviously all these amazing stories about what patients are seeing with StemWave as far as results and getting their lives back. But you have kind of a little bit of a fun thing too, is that you get to treat professional athletes as well. Tell me a little bit about how that started.
Yeah, so I think obviously my journey as a professional athlete, that opened some doors, created some relationships and connections that I was able to just continue to cultivate. And then one player ended up coming in for care. He told another player, and it just kind of snowballed from there. And again, I think it's because of the access to the style of treatment and things that we could provide. And that's been super, super fun. So we talk about those opposite sides of the spectrum, right? Like, let's just get this player really healthy, or allow them to be able to do what they're really good at and get them back on the field, versus someone that I just really want to be able to run around with my grandkids this summer. Yeah. So it's been so neat to be in those experiences. And obviously, being a high-level athlete, having been in those professional settings, it's super fun to stay involved in some way, because it's really, really neat to see these athletes be able to do what they want to do at a high level, where sometimes if they don't have access to certain styles of care, they're going to be out for a little bit longer. And it's just fun to be in that environment as a resource, to be able to give them some other options and other opportunities where, their seasons aren't always for a full 12 months. So what do they do in the off season, and being able to be a resource then as well. And it's really, really fun to be able to use the tech like StemWave to, again, just be able to decrease the pain, decrease the inflammation, increase the function, and get them to be able to go out and perform and do what they do best.
Yeah, and it's an interesting twist too, because like obviously we talked about with like, you know, regular people, just getting them moving the way they want to move and doing the things with their families is amazing. But for a professional athlete, this is their job. Like,
right.
Like they're out of work if they can't be on the field or on the court or whatever it is. What have you seen when treating like these professional athletes? Because a lot of them have seen all sorts of different modalities and training, you know, remedies and whatever. And then all of a sudden they're trying something new in StemWave. Like, what have you seen as far as their responses to it?
Yeah, I mean, I think those players will do whatever they can to be able to get out on the field, because like we said, it is their job, it is their livelihood, and they have certain accelerators based on their contracts and things like that. So they want to look into every single avenue to get better and stay better. And using StemWave has been really neat to see just their ability to respond relatively quickly, because those types of athletes, they definitely are built different, and they can handle things in a different way. So you can be more intense with certain styles of treatment. You can increase the volume of things, and being able to see them respond a little bit quicker, their body's able to integrate and adapt more readily so they can go out and perform. That's been one of the neatest things to see, especially with the introduction of StemWave to their care.
Yeah, I know, and I know you know this too, that, you know, we work with professional sports teams. We're with the Washington Commanders. They have a device, and from talking to their head trainer, it was, you know, relayed to us that there are players that come in and ask for it by name now. I mean, these guys have been playing since they were kids, so they've had, you know, all the different types of treatments, and now this thing is like doing something that they've never experienced before. It's like it's taking that pain away. It's getting them feeling more mobile and things like that. So it's really cool for us to hear that, like, in this world where you have like the highest level athlete who's seen it all of a sudden they're introduced to something new, and now they're like asking for it by name. In your athletes, have you seen them really gravitate towards what StemWave can do for them compared to like what they've traditionally had in the past?
Yeah, 100%. We have athletes that specifically just request that, you know, and depending on where they're at in the off season or their location to our clinic, you know, they'll ask, okay, well, can we use StemWave? If, you know, I come in today, I want to make sure we use StemWave. Because, right, we can do all these other different soft tissue techniques, the adjusting, the corrective exercise, the rehab, but StemWave just, I would say, it just elevates the treatment tenfold.
And that's going to be such a cool feeling for you too, to be like able to offer something like that to these high-level athletes.
100%. And that's where, when we talked about like the clinic and the setup, right, we talk about the professional athlete treatment. This is the professional athlete treatment. But why can't we provide that to the non-professional athlete as well? Yeah. And it's been so cool this year, the response and the results so instantaneously with it. It's
got to be cool to be able to have a patient who's just like, you know, a regular person and be like, oh yeah, we're going to do StemWave on you. By the way, all these guys in the NFL, NBA, whatever it is, are using it too. And they'd be like, oh, well, yeah, I'm up with them then. Yeah. That's cool.
Well, that's important to me too, because, you know, those professional athletes are people.
Right.
You know, these patients are people. It's really not any different. Because, you know, I love to give this analogy. Whether you are in the NFL, in the NBA, and you need to do what's demanded on you to be able to move and function, or you're my grandmother and you have to be able to squat to get into your car.
Yeah.
That's an athletic movement. And if we can use modalities like StemWave to make that happen even more seamlessly, pain-free, why not?
Yeah. I love the story you told earlier about the hug and the tears.
Yeah.
And originally you thought they were tears, they were pain tears, but they were happiness tears.
Yeah.
Do you have any more like anecdotes you can share about some truly remarkable results with StemWave?
Yeah. Man, so many. We had an athlete preparing for the NFL Combine. Ankle issue, just wasn't really responding. and started adding StemWave in. And he had to go do a pro day. And obviously, right, there's a lot of factors that come into this, but after using StemWave, doing treatment for a couple weeks, he ran his best 40 time, doing a private workout for an NFL team. That was really cool to hear.
Wow.
Had another patient, shoulder issues, rotator cuff tears, was a high school pitcher, was told he couldn't pitch. He was able to pitch towards the end of the year. When he was told, like, you can DH and just play first base, but don't really throw. And he was pitching towards the end of the season.
Wow.
Those are just super neat things. We had another now he's a collegiate second baseman, rolled his ankle like game 2 of the season. And was told, like, yeah, it's a high ankle sprain, just rest it, you got to play in college. He came back to play the last 2 games in the playoffs.
Wow.
So that was really neat, and having those conversations then with the orthopedic and the PT, like, hey, well, this is what we're doing. This is one of the things that really, really is like up the ante and created a significant change. And so they were asking about it, and those stories are super neat.
So if I understand you correctly, if I do StemWave now in my 40s, I can make it to the combine and get to the NFL?
Yeah, I think so.
Okay, and my 40 time will get faster?
Yeah.
I'll finally
easy,
be able
man.
to run a 6 flat.
It's that easy.
That's amazing.
Yeah.
Final questions here. What's something that surprised you? I mean, I know, obviously you did your research about StemWave, from the very first Dr. Madison talk you had, and obviously talking with our sales team. But like, what's something that really, like, you weren't expecting?
I think anytime there's a different modality or there's a new thing, everyone wants to try and use that. And then after a while, you feel like it's just going to kind of go to the wayside. Then it's like, what's the next thing? What's the next thing? StemWave has only evolved like year after year. And I'm super fortunate to be a StemWave provider and being able to see that evolution of it. The technology only gets better. The patient results only get better. There's only more individuals that seek out that style of treatment. That has been surprising because there's a lot of different practitioners, even now, like friends I went to school with, physical therapists I'm close with, that they'll get a new modality and then they'll just collect dust. Mm-hmm. But using the technology, the ROI, the value, all of that is there because the patient results are there. And so that's been one of the coolest things for sure.
And how does it make you feel knowing like what you can provide your patients by having StemWave?
I mean, we have this conversation with all of our clinicians every week. There is not a single person that walks through the door that I feel like we cannot improve their quality of life in some capacity. Obviously, like we talked about, there are 100%, there's limitations of matter. And I get that. And like, you got to be the doc. But there's no reason we can't improve someone's quality of life. And StemWave is a huge, huge part of that.
Okay. So one last question. If you were going to recommend StemWave to a colleague, like, what would you say to them?
Yeah, I mean, I would tell them that this is the ultimate way to complement the style of care you're already providing. And if you do not have this sort of technology in your practice within the next couple of years, you're going to be very far behind and your patients are going to seek results elsewhere.
Nobody wants that.
Nobody wants that.
Everyone should get a StemWave. Awesome.
Yep.
Well, Dr. Wagner, thank you so much for coming out here, sitting down with us, telling us your journey with StemWave. It sounds like you're getting incredible results. 3 units. That's amazing.
Yeah.
I feel like you should like have some sort of like belt or something, like a championship belt that has like 3 units on it.
Throw it over my shoulder.
Yeah, right?
Yeah.
Awesome. Well, appreciate you. Thank you so much.
Of course. Thanks for having me.
Awesome.